In solidarity with the government, we are ready as WHO to join efforts to provide relief, and today I'm very pleased to be able to, as an immediate response, provide 8 tons of critical medical supplies to you, Honourable Minister, and to the Ministry of Health and Ghana Health Services to support the response to the health needs of the people as a result of the flooding. So, indeed, in our region, our countries face a heavy burden of public health emergencies. When we count the disease outbreaks, the weather events that take place in our region, we are a region that's particularly affected in this way. And mainly we do see disease outbreaks, but we're seeing more and more that what's happening is climate change is triggering extreme events such as flooding, drought, and food insecurity. I'm very much, just in passing, would like to emphasize that in fact we have been preparing with our country reps to make sure that the health sector is adequately represented at this conference of the parties.
Specifically to attend the meeting that starts tomorrow, the Interparliamentary Union meeting, which will be discussing health security on the continent, but also to pay a courtesy call and commiserate with the Minister of Health and the government of Ghana on the floods that have occurred in Ghana. And so in this courtesy call, she was able to mobilize resources to donate a number of medical products that could be distributed in these areas that have been affected by the floods here in Ghana. We do have the specific amount, the total in US dollars of the commodities that are being donated are about 65,000 US dollars, which is roughly almost 800,000 Ghana cedis. But it's not about the money, it's really about what these commodities are going to do. That is important. These commodities are going to alleviate the challenges that colleagues and friends and families are facing in the drought, rather the flooded areas.
The area has said adequately that this wasn't a disaster in terms of we sitting down and things overtaking us. They forewarned, they knew what they were going to do. Here they sensitized, how do I call it, the residents there. That is how come we haven't seen deaths happening to this one. But this year, what has happened in this country, and you guys are not reporting that, we have had excessive rains, more than normal. Those of us who are farming, if we go to Fongisi Dam, Valley, as I speak, November, there are still some pockets that's soaked. There is water. They can't even harvest rice around Kintampo area because of flooding. You know, people have lost their farm proceeds, not only down here, but even within Savannah and some parts of the Mississippi. So we have had excessive rains, but there was the need for us to open the dam. Other than that, we have a whole breaking of the dam like happening where Libya, you know. So we knew, the people prepared, VRA was on top of it, you know. That is how come the impact had been a bit minimal, but no matter how it affects anybody, you can't say you are not concerned. Government is pushing to do the best that we can.